The deadliest fire in California history is also being blamed for poor air quality across the state. Thick plumes of smoke and black fog shrouded communities. Air pollution like that is full of tiny particles that can cause health problems, ranging from temporary discomfort to long-term heart and lung diseases. More than 20 California cities were listed Monday as having an air quality index of unhealthy. Ed Avol is a professor of clinical medicine and acting director of the Environmental Health Division at the University of Southern California Department of Preventive Medicine. He joins me now from Los Angeles. All right, Ed, explain to me, how bad is the air quality right now in Northern California?
Well, the air has been pretty bad. As you point out, there are many communities across the state that have unhealthy air, which means that it's not a good idea to be outside breathing it and certainly not outside exercising in it.
So what are some of the long-term health effects that this could cause if, for example, you wanted to go out and walk around in it?
Well, so there's a whole range of health effects. We think about it first as being respiratory, and that certainly makes a lot of sense because you breathe in the smoky air. But actually, once it gets past the air-blood barrier in the lungs, it can go to most any organ in the body because it travels through the bloodstream. And so for people that have pre-existing respiratory disease, it's clearly a problem and may exacerbate to make worse their existing symptoms, et cetera. But in the long term, we have to think about other things, such as everything, especially younger children, everything from for pregnant mothers, exposure because the developing fetus may be affected by this, and for longer-term exposures in terms of chronic health effects, exacerbating, making worse sort of existing conditions, or in terms of children, again, somehow perverting or shortening the maximal growth span that you'd like to see for those developing organs.
So what is it about this fire that has caused such severe air pollution?
Well, part of the problem has been just the continuity of it, just the duration. So many days of very heavy smoke and moving through a wide area. Then the other issue, of course, is the exposed population. The way the winds have been blowing, it's been blowing it right across through Sacramento, right to the San Francisco Bay, where we have, literally millions of people. So there's a large population being exposed to these combination of smoke, particles, gases. And it's not just, we think about it as wildfire, but it's not just wildfire in the sense of smoke from wood, because it's also homes and buildings and the plastics and the asphalt shingles and the furniture and everything else that's in the home that also is up in the air combusted. So there's lots of chemicals in the air.
Well, some people do need to go out. They need to go about their business. I mean, how much is too much for people in the area? And is there anything you can do to protect yourself if you do have to go outside?
Well, there are a number of things you can do to protect yourself. Again, as you point out, if you can, it's better to just avoid being outside. But for many people, that's just unavoidable. So there's been a run on the masks available here. Got to be careful about getting masks. Masks are certainly useful if you get the right mask, because there are certified masks that do effectively protect from these small particles. And just putting a rag or something up your face really won't accomplish much. But for people that can avoid exercise, increased exercise levels, working outdoors, et cetera, that's all good practice to do in this case. And again, for those who can, staying indoors, keeping the windows closed, running the air conditioner on recirculator. If you have to be out in your car, for example, running the ventilation system in your car on recirculate. All that will help to reduce somewhat the exposure.
The Woolsey fire near Los Angeles also created a haze over some communities. So how is the air quality in that area? Is it a similar risk?
It's a similar risk here, too, because although it hasn't been quite as widespread, we have, unfortunately, we still have almost 100,000 acres burned here in Southern California. And so that smoke, while a lot of it has gone out over the ocean, has also hit a large population, a large portion of Los Angeles. And so a lot of people have been sort of affected by it, both in terms of short-term irritation, medication increased usage, potential exacerbation of existing asthma and other sorts of respiratory problems, but also just a general concern about the restriction from physical activities, closing of schools. So a lot has changed in the last couple of weeks because of this.
All right, very important information. Thank you so much.
You're welcome.
After more than